Mihira, I want to emphasize the importance of infusion rate calculations. It's a crucial aspect of patient care. Even a small error can have significant consequences.
I understand, Mario. I always double-check my calculations.
That's good. Remember, it's not just about the total volume, but also the drip rate. Factor in the drop factor of the force set. And always consider the patient's condition. For example, a patient with heart failure might require a slower infusion rate to prevent fluid overload.
I'll keep that in mind.
Also, monitor the infusion site closely. Mihira, look for signs of infiltration or phlebitis. If you notice any redness, swelling, or pain, discontinue the immediately. And don't forget about medication compatibility. Some drugs can't be mixed, so always check the drug handbook. That's a great question, Mihira. When you're preparing for surgery, we need to make sure everything is just right for you. To do this, we conduct what's called a preoperative assessment. Think of it as a thorough checkup to ensure you're as fit and ready as possible for your procedure. This assessment typically involves a few important steps. For example, we'll usually ask you to have some blood and urine tests done. These are very common and help us get a good picture of your general health and how your body is functioning. Sometimes, depending on your health and the type of surgery, we might also need to do an ECG, which is a simple and quick test that checks your heart's rhythm, or perhaps a chest X-ray to get a clear image of your lungs. These tests are all about gathering vital information to help us plan the safest and most effective care for you. Beyond these tests, you'll also have important consultations with our medical team. You'll meet with the anesthetist, who is the doctor specializing in pain relief and anesthesia during your surgery. They will discuss the best type of anesthesia for you and answer any questions you might have about it. You'll also have a chance to review your medical history with the surgeon. This is a great opportunity for them to understand your past health in detail and for you to ask any remaining questions directly. All of these steps are designed to make sure we have a complete understanding of your health and that you feel comfortable and informed every step of the way. Is there anything about those tests or consultations that you're particularly worried about, or any other concerns that come to mind?